Hi, my name is Eric Krell. I'm a physical therapist and co-owner of Rocky Mountain Spine and Sport. We have 6 locations here in Denver, Colorado, and today I want to talk a little bit about patellofemoral syndrome. This is Robin. Robin actually works for us. Robin came to me several months ago and was complaining of knee pain in and around the kneecap, hurt to run, couldn't walk up and down stairs. Squatting, all that was painful. She did the Tough Mudder, or she was signed up to do the Tough Mudder for her 3rd time, I believe, and needed to get this knee fixed. It hadn't been hurting but for maybe about 3 weeks or so. So Robin came to us really early. She didn't wait. Real quick, talk a little bit about patellofemoral mechanics. The kneecap, or the patella, is this little bone right here. Years ago, they used to remove these if you fractured them. They just took them out if it was a really bad fracture. They figured out real quick that this little bone is very important. This bone acts like a pulley system. It allows our quadriceps to do a lot of work. Okay? It gives our quadriceps what we call mechanical advantage to be very strong. So when you bend and straighten your knee, this patella should glide on the end of the femur here, these femoral condyles. What happens in a lot of people, it's very insidious onset, is, and what I mean by that is there's no trauma, it just happens, is this patella starts tracking incorrectly. And if you've ever been working out on a machine that has pulleys on it and there's some friction, it doesn't move so good. It's inefficient movement. Over time, that can wear away the what we call the subchondral surface, the cartilage underneath the patella and on the end of the femur. It can cause swelling and a lot of pain. Anyway, Robin came to us really early. She got on top of it. I signed up for the Tough Mudder. I've got to do this. And we started working on her knee. One of the things that we did with her knee, grab a towel here. As I took that down, it popped. Kneecaps oftentimes do that. Is we just move the kneecap around here, try to see and assess how well it moves. It should freely move side to side. Some people kind of get weirded out by this. I actually had one person pass out one time. It should move like this. So hers is moving rather appropriately still. That's because she's been doing her homework. But when she came to me, this was not moving. And the main direction that I typically try to get this thing to move is down and in, this direction. There's a tendency for people to get very developed in their quads out here, the lateral quad, and oftentimes this medial quad is underdeveloped, okay? And then people get very tight out here in this lateral tissue. So for Robin, because she didn't have any swelling in the knee, or at least any visible swelling, but she had some pain out around this lateral side of the patella, the primary treatment in the beginning is stretching and really manipulating this kneecap. And she's making faces now. She doesn't like that. So it's a little bit sore and uncomfortable. But this lateral pull right here, if you can imagine there's a little cookie right there. This little cookie, this is the left knee, sits right there. And I'm taking this thing down and in. And I'm stretching all this tissue. There's a lot of tissue up here, not just muscles, but a lot of what we call retinaculum. And that stuff gets tight over time. And you really engage that, and you teach the patient to do this, and it'll really free up that knee mobility. A lot of times they don't like it in the beginning, and you won't like it in the beginning, but after a few sessions, a lot of times they're saying, oh, that feels really good. And obviously, then you get them stretching their quads, get them doing some medial strengthening, and typically if you get on these things really early, and they don't have a lot of arthritis or what we call subchondral lesions, then they typically do very well. Without taping, by the way. A lot of people tape out there. I'm not saying it's wrong. I haven't taped the knee for 10 years. I don't feel like I need to. But anyway, very, very basic thing. It's a very common problem. There's a lot of people running around with these things, and sometimes it hurts for a few weeks and then it goes away, so nobody ever does anything about it. And then it crops up again when they change their activity level. If they would just get it taken care of sooner than later, they could kind of keep this knee feeling good all the time. Thanks for listening. Take care. Bye.